Thanks for joining us today. Welcome to the Center for State's video series on readiness. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Readiness Brief is intended to help child welfare agency leaders, managers, and stakeholders determine an approach to assessing readiness and understand the key factors that influence readiness. It does this by providing step-by-step guidance to examine readiness and analyze findings throughout the change and implementation process. In this module, we will continue our conversation about readiness by following up with how to analyze assessment findings and decide next steps. As a reminder, by now teams seeking to assess readiness should have reviewed and considered the factors that contribute to readiness, developed the assessment approach, and conducted the assessment. Once the assessment has been completed and data collected and organized, the team will analyze and summarize findings using any data support specialist that they need. Teams should not expect that the agency will be fully ready in every area. In fact, it is more likely that there will be areas that need to be developed over time. Assess the readiness of the organization to embark on change or to implement the proposed intervention. Identify particular areas of strength that can be leveraged. For example, leadership support, program champions, connections to existing initiatives, or already established infrastructure. Identify areas where capacity needs to be built. For example, relevant knowledge and skills, performance assessment systems, or interagency relationships. Build a shared understanding of the agency's current status. And prioritize activities that prepare the agency for change. For teams who are using the Center for State's Change and Implementation Readiness Assessment tool, upon completion of Part 2, the readiness items, the team is encouraged to reflect on the assessment results and what they mean for moving forward. The team should summarize the 3 areas of key assessment findings in Part 3 of the tool. They should highlight strengths and identify how strengths can be leveraged to build support and a solid foundation for the change. For example, is there strong leadership to guide or strong champions that can help create buy-in for the change effort? Are there strong community partnerships to ensure that the change is implemented with some level of fidelity across systems? The team should identify areas for further development and prioritize what must be done before implementation efforts begin and what may be an ongoing effort. Are there additional resources, engagement, or partnerships that need to be brought in before moving to implementation planning? Are there gaps in knowledge or skills that could be addressed through training, hiring, and ongoing coaching? Are there systemic or technical areas that need to be addressed, such as an update to the Child Welfare Information System or improvements in data collection? And teams should take note of key challenges or barriers that are likely to impact the agency's ability to effectively move forward. Are there relationship barriers that might impact the ability to engage community or cross-system partners? Are there policy or legislative issues that might inhibit the ability to implement the program or practice changes that are needed? Are any of these barriers things that can be addressed, or does the implementation plan need to include strategies for accommodating them and still move forward? All of this information collectively will inform the next step in the change and implementation process, implementation planning and capacity building. As previously mentioned, teams can use the findings to determine next steps. There might be several choices available to teams, and decisions might be based on a number of conditions or connections to the purpose of the readiness assessment. Are there a large number of items that are marked as don't know? Perhaps some additional focused assessments might be needed to determine if there is a level of readiness, for example, focus groups or targeted surveys. If the organization feels confident in its readiness for a selected intervention, it may be ready to move forward with implementation planning and capacity building. The assessment may have been part of an ongoing CQI process, and the data needs to be tracked and measured against previous assessments to see where any improvements have been gained, or if there are areas that are moving in the wrong direction and need to be addressed as part of ongoing efforts to improve. Time available is often a critical factor in deciding next steps. Teams may not have time to incorporate additional data collection, or have time to address some of the gaps revealed by the assessment. They might have to adapt the intervention or change initiative to meet the organization where they are at, or adapt the implementation plan to accommodate for areas that lack adequate readiness. Readiness and capacity evolve over time, and assessing readiness should not be a one-time occurrence. As part of implementation monitoring, teams should reassess their readiness and capacity at multiple points in the implementation process, particularly for multi-year change initiatives. Tracking readiness factors over time can update teams on their progress and also identify emerging needs or potential barriers that might affect ongoing implementation or expansion of the intervention. Periodic reassessment of readiness factors can help alert implementation teams to specific areas that require attention and focus their next steps. For example, have changes in leadership or agency priorities affected the commitment to the intervention? Do new staff have the knowledge and skills needed for the intervention, or are changes to training and coaching systems needed? Or do other aspects of readiness need to be addressed to sustain the intervention? In Module 3, we discussed an example from the Washoe Family Search and Engagement Program Manual of 2016 of assessing readiness. Let's check back in with them after they completed their assessment to hear about what they learned and their next steps. Results of the survey showed that Washoe County Child Welfare Agency and the contracted service provider had the organizational and staff capacity to implement the selected intervention. Several existing organizational mechanisms and supports ensure implementation with fidelity to the program model and best practice standards. These included team meetings, weekly case staffing with a supervisor, practice standards, fidelity assessments, feedback, coaching, and technical assistance, routine quality assurance checks, and ongoing monitoring by the project implementation and management teams. Besides these specific supports and organizational mechanisms to implement the intervention, the partner service provider had dedicated staff already familiar with the agency's practices and policies, and the system's climate was supportive of the project. The agency also had support from the state child welfare leadership. Key stakeholders were involved, and there were strong public-private partnerships to support the services to be implemented. To prepare for implementation, the agency organized their next steps, including the tasks that needed to occur, the products and tools that would need to be developed to support implementation, and the system changes that would need to take place before implementation activities could begin. It sounds like the county has fully analyzed the assessment and determined their next steps before moving on to implementation planning. Let's take a moment to check in on what you've learned about analyzing assessment findings and determining next steps. How do teams analyze assessment results? By identifying strengths, areas to build capacity, and potential barriers to readiness for change and implementation. What factors can help determine next steps? Any additional data needs, previous assessment results and continuous improvement efforts, time constraints, or whether an intervention has been selected or not. Why should teams reassess over time and at multiple points in the process? To provide regular updates to management or teams involved in the change, identify emerging needs or barriers, or alert to items needing attention. Now take this a step further by reviewing the reflection questions and practice exercise for Analyze Results and Determine Next Steps in your Readiness Workbook to connect what you've learned to your own experience. As a recap, the modules in this video series on readiness include why teams should assess readiness, consider the factors that contribute to readiness, develop an assessment approach, and then conduct the assessment and analyze findings. Feel free to go back and re-watch any of the videos in this series to refresh your memory. Remember to use the Readiness Workbook to reflect on your learning, record any outstanding questions, and think through your next steps. Join us for the other videos in this series to learn more about the essential functions for each part of the change and implementation process.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.